And good evening, I'm Erica Eastep in for Lori Tucker.
I'm Gene Patterson. The U.S. Supreme Court today handing down a long-awaited decision on the Patient Protection and Affordable Care Act.
That's right. It's a hotly debated health care reform law passed by Congress in 2010 with the support of President Barack Obama.
Today, in a 5-4 vote, the nation's highest court upheld the bulk of the law, including requiring all Americans to buy health insurance.
Justices ruled that the penalty for not having health insurance could be considered a tax, something Congress can regulate.
The court also put restrictions on the law's expansion of Medicaid, saying if states refuse to take part, the federal government can't take away all Medicaid funding, only the new money for the expansion. Well, tonight we have team coverage of East Tennessee's response to the decision.
That's right. 6 News reporter Alexis Zotos joins us now live from downtown Knoxville at a rally where they're cheering this decision. But Alexis, you also heard other reactions from the healthcare industry, right?
Well, that's right, Erica. I'm actually in Crouch Park downtown where the rally is just about to get started here. It's a celebratory rally hosted by the Tennessee Health Care Campaign. About a couple dozen people are actually here gathered right now. You can see some signs behind me. They're here to celebrate today's ruling. Now, I spoke with people of the medical community today, though, who had mixed responses on what the actual effect of today's ruling will mean for them.
Clearly a good day for the consumer of health care. And from our perspective, it's a better day than the alternative.
For the Summit Medical Group, today's decision is what they were hoping for.
We were already operating under the assumption that the Healthcare Reform Act would be upheld and have been for the last 2 years making provisions to prepare for that.
But for Covenant Health, they are still trying to understand exactly what today's ruling means.
There's not enough information out there to see how they're going to implement some of these things.
John Jeffy, the chief financial officer at Covenant Health, says between 5 and 10% of their customers may be affected.
Our patients that we see today, we're going to continue to see today, whether or not they have coverage or don't have coverage. And I think that's the unknown part of this.
And many questions are raised by how exactly Tennessee will implement the law.
If our state opts out, we don't know where that leaves us. And even if states around us opt out, you're going to see some people migrating across state borders. And so I think there's a lot of uncertainty.
But the industry seems to agree that despite uncertainty, today's ruling is a step in the right direction.
And it is, we hope, a step in a long journey of stabilizing our present healthcare system, and we must understand we've got to be a participant in finding solutions to do that.
Now, for the people here at tonight's rally, they only see today's ruling as a positive and a great monumental event. Now, again, it is supposed to get underway here in a couple of minutes. There are a set of speakers that are going to be speaking tonight about the ruling, people from the medical community as well as the religious community here in Knoxville, and anyone that wants to share their personal stories about how this health care bill is affecting them is welcome. As you can see, it's about to get started. Live in downtown Knoxville, Alexis Zotos, 6 News.
All right, thanks, Alexis. We also heard today from UT Medical Center administrators there say that they've been preparing for this law to take effect for many months, so that this decision won't make much of a change in those plans. Also, they can't say for sure that it would bring more patients, but it may change the type of care.
What I would hope is that, therefore, more individuals would access non-emergent care, would access regular routine care and preventative care especially, and I think that would be something that could be accomplished.
These decisions are going to definitely impact on how physicians provide that care, and there are lots of things that we need to do to make sure that with physician shortages, you know, the dollars that are going to be spent to increase the number of people coming to the doctor is going to be, you know, have an impact on how we provide care.